Welcome to Music and Medicine on Monday, a collaboration between the School of Music and the College of Medicine here at the University of Iowa. This podcast is designed to help musicians play and to stay healthy. Additional information is available on our free medical website called the Iowa Protocols that can be found by searching for Music and Medicine on Monday at Iowa. We are coming to you from the recital hall at the beautiful Voxman School of Music in Iowa City. My name is Harry Hoffman. I'm a physician at the University of Iowa, and I'd like to introduce our featured performers today. Matt Dulas is playing Euphonium. He's a second-year master's student in music performance. Brad Balster is a sophomore, also in music performance, playing Euphonium. Drew Bonner is a third-year DMA tuba player, and John Reyna graduated 2 years ago with a master's, about to become a technical sergeant in the U.S. Air Force concert band playing the tuba. The focus of our session today is on breath support with attention to pulmonary issues designed to maximize performance and minimize injury for wind instrument players, particularly tuba and euphonium. With us today are John Manning, an associate professor of tuba and euphonium at the University of Iowa, Jeff Wilson, professor of pulmonary medicine at the University of Iowa, and Nick Bainey, a respiratory therapist who is the coordinator for education for respiratory therapy at the hospital. Before we start with the performance, maybe we can get a little background as to where you came from to get to this position. Matt, do you want to start? Talk about what got you into playing the euphonium, what your inspirations were?
Yeah, certainly. So I come from Pipestone, Minnesota, small town, and our school district, the way things were run is we would start band in 5th grade. And so the spring of your 4th grade year, you would be introduced to all the instruments that you could play, and you got to try them out a little bit. And I went in thinking that I was going to choose trombone because that's what my dad played, and there's just that influence there. But I don't know, I just saw the euphonium and I was like, this is like the holy grail of instruments. I found it and I just wanted to play it, and the rest is kind of history. So
Terrific. Brad, how about yourself?
Yeah, so I guess for me, I went into also in 5th grade to try out and be a part of the band. And at first I started on the trumpet, couldn't make a sound out of it. Then I went to the tuba and I made just the weakest sound in the world you can imagine. And as you can see, we kind of got the little baby between the two instruments and the euphonium, and somehow it kind of just led me to being able to play the horn. So that's kind of how I got into it.
Terrific. And Drew, obviously it's your passion. This is your career you're playing.
Indeed. I was very musically inclined from a young age. I actually played drum set was my first instrument, and then took piano lessons, took drum lessons, and guitar I taught kind of myself after some research on the internet. And then once I hit school band age, I wanted to play the tuba, but there were no tubas left because they went down the class list alphabetically, and somebody in front of me with an A last name, I guess, chose the tuba. And so they said, you can have the small tuba. And so I started playing the euphonium initially, and then went to college for music and at my undergrad at Penn State University, and got my master's at the University of Texas. And now I'm here playing tuba and euphonium at Iowa.
My understanding is that you plan to arrange, or you already are arranging pieces for marching bands, including
I do.
University of Wisconsin, University of Iowa?
Yes, indeed. Very involved with the athletic bands here at Iowa, and do freelance work with a number of universities and high schools around the country. And so that's kind of my other passion besides playing music. I enjoy writing it as well.
Terrific. And John, how about your background?
Yeah, my siblings, 2 of them played instruments when I was growing up. My sister played the clarinet and my older brother played the baritone saxophone. So I'd kind of grown up listening to music while they were middle and high school. So when I entered in middle school, I started on the trombone. And when I was in 8th grade, they needed to fill some spots in the high school marching band. So they asked local middle school students, and I wanted to play the trombone because I played the trombone, but that spot was filled. But the band director said, we do have a sousaphone spot available, which is kind of like the tuba. You can just hold it, you don't have to play it. So I was like, okay, I'll do that. But I wanted to learn the music too, so I did. And I ended up asking my middle school band director if I could just switch to the tuba, and the rest is history.
And did you end up just holding it or playing?
By the end of the season, I was playing too.
But you were just marching
Barely.
around without playing it for a long time.
Yeah, for a little bit, yeah.
That's terrific. So Drew, can you talk a little bit about the piece that you all have chosen as a group to play?
Yeah, so this piece is called Gravity Dances, and it's by a tuba player, a composer and tuba player named Tony Zelenchik. And he's the professor of tuba and euphonium at Capital University in Columbus, Ohio.
Students beginning with the marching band at the University of Iowa carrying the sousaphone around often are so short of breath that they're just carrying it and not actually playing it. Is that true?
Very true. And it's not just the sousaphone too. You'll see a lot with brass instruments just because there's such an air demand when you're already doing an aerobic activity, you're marching. And when you add in that second factor of the instrument and having to focus on putting air through the instrument, having a good sound, but also being able to support your body and be able to replicate what everyone else around you is doing, it's very cumbersome. And still, like, there's still multiple factors of, like, an experienced player, you're gonna get tired eventually, so you might have to trade off when someone's playing with your neighbor next to you. So it's a very tough activity to try to learn, so.
Terrific. So Drew, can you say the name of the song you're playing one more time?
Yes, it's called Gravity Dances.
Any reason they call it that?
I don't believe so. I think he was probably just trying to think of a cool name.
It is cool. All right, we'll look forward to watching it.
Yeah.
So John, do you want to comment on your students' performance and maybe some health issues kind of blending into that comment?
Sure. Well, bravo. It was a great performance. And this is an award-winning quartet. They won first place in a chamber music competition at the Great Plains Regional Tuba Euphonium Conference last May. So they're in great shape.
So breath support is a key issue to discuss, and we're blessed to have a pulmonary medicine doctor of the highest standard here, Jeff Wilson, Dr. Jeff Wilson. Do you want to make some comments on just particular what you have seen here with respect to breath support, and then we'll go into more detail.
Yeah, thanks, Harry. You know, I have to say, just watching you guys, I'm in awe of the sound that comes out of those instruments. Having blown into my son's trumpet a few times and having your experience of no sound coming out. And so I asked myself, you know, God, these guys must have really above normal lung function. And I'm wondering if, you know, somehow people that have above normal lung function are selected out as playing wind instrument players. And so reading about that, the answer I think is no. Your guys' lung function is similar to people who don't play wind instruments, but you just have such fabulous technique. And you've worked at it so long that you can make these incredible sounds with just really, you know, the same lung function that the rest of us have. So kudos to that. Yeah.
So for Matt, Brad, Drew, John, have you done anything special to try to exercise in order to have adequate lung support? I know that marching around is different from just sitting and playing, but I suspect it's important to be attentive to that need.
Certainly, I have. There's a technique book called The Breathing Gym by two tubists, Sam Palafian and Patrick Sheridan, and Sam Palafian is actually Professor Manning's teacher, so he's my grand teacher. But they wrote this technique book called The Breathing Gym, and it's all about breathing and using your lungs to, the best way possible. And it's really about, I think, how we blow out, like at a different rate. Like when you're just sitting normally, you're not thinking about, oh, I'm breathing slowly or quickly. But when we play music, if we want to play a loud note, we very quickly. If we want to play a soft note, we have to kind of monitor how fast we're using our air, rather than just sitting and not thinking about it normally. I don't know if you guys have anything else to add.
As a side tangent, other than I agree with everything you said, but also I found, at least for myself, I'm very into exercise and also like distance running and that. And I find that the quality of your breath and the control you need in those types of physical activities also comes into your horn in that, just because when you're doing, for instance, like if you're working out, let's say you're bench pressing, you need to have quick, strong air because you need to fill your body with that oxygen to make sure you're optimally performing. And just like that, we need to control the amount of air, kind of like what Drew was talking about, and how we decide how much air to use at a certain point. Or like, as you just heard, we have super loud moments. How do we have to breathe in? How do we have to push that air out through our horns? So I find a good correlation between those two.
Between athletics and musical playing and with the wind instrument. John, you had a comment too.
Yeah, similar to Drew, I've experienced the breathing gym exercises before in high school, especially doing marching band. That was kind of what they started us with to get used to breathing like that. But I've spent a lot of time on understanding how I can get a good breath in and out without it being with like an exercise, because we want to have a certain shape as we're intaking air so that the sound that we put out is also the tone quality that we want in the instrument, which is more of a round sound. So we don't want any interference from your tongue or your throat. So yeah, I've spent a lot of time just understanding how I'm taking my air in and how I'm putting it out and making sure that it's smooth and calm.
Well, Jeff gave me the sobering fact that pretty much our lung function is what we're born with, and it tends to, deteriorate after age 20?
Yeah, I hate to tell you guys this, but after 20, our lung function starts to go down. I think what you're talking about, though, is, so when we talk about lung function, we're talking about it in our lung function lab, where we have people take big breath in and then blow it out, and we measure how much comes out, and that part of it is normal. But I think what you guys are getting at is the muscle part, right? So to take a breath in, your diaphragm has to work well, and you have some other breathing muscles up in your upper chest and neck. And then to breathe out in a forced maneuver, it's primarily your abdomen muscles. And when I was watching you guys, I was watching your abdomen, and there's this, tensing intermittently as you go on. So I think the muscle aspect is something that you would benefit from, in just general conditioning, like you're mentioning.
So we do have a pulmonary rehab clinic or pulmonary rehab situation for patients. They're not really rehabbing their lungs as much as strengthening the rest of their body and their muscles around their lungs.
Yeah, and I think Nick, you have some kind of things that you brought today.
Do you want to address that, Nick?
A little bit?
Kind of as stated, when you're doing pulmonary rehab, you're not necessarily you're not working out the lungs, or you're not working out your diaphragm, which is the core muscle that allows us to breathe. With pulmonary rehab, you're trying to get the rest of your muscles functioning more efficiently, trying to gain some endurance, which then in a roundabout way improves your overall health, which can help with breathing and exercise. There aren't a lot of tools to use per se, but the biggest one that I think that would be beneficial is this guy. If you guys don't know what this is, do you guys know what it is? Incentive spirometer. Some people call it a Voldine. Depends on what hospital or what school you went to. But basically what this does is it helps you take those long, slow, big, deep breaths. So you're opening up your chest, getting that nice big open chest, popping those alveoli open. It's interesting because when people see this device, they think they need to take a big, quick, it's about taking a quick, deep breath in. And it's actually the exact opposite. You want to do that long, slow, deep breath. And this is a feedback tool, which has, smiley face with a green dot that floats that lets you know that you're doing the right flow. And then it also has a mechanism that goes up to show kind of what your total lung capacity is as you do that long, slow, big, deep breath.
Has that been used yet?
This one has not.
Do you want to have one of the students, you want to demonstrate?
My bet is John has the largest vital capacity. He's the tallest.
All right.
So have you been familiar with this before, John?
I've never used this before.
Okay, so the way you do it, you're gonna hold on to it. You're gonna sit up nice and straight, mouthpiece in your mouth.
Okay.
And you wanna keep this as straight as possible, as flat as possible, and just long, slow, big, deep breath. Make sure you're following your feedback here. And then let us know how high you're able to get that.
About 2,250.
So me personally, the highest I've ever done is about a little over 2,000. So that's impressive. That's impressive. So that's just saying, and I mean, there's more room that can go into your lungs. That's just your body kind of tells you, okay, enough. So that's really impressive.
Sweet.
Now, the trick with this is we do this a lot with our patients at the hospital when we want them also to work on getting up and getting moving and mobilizing after surgeries, pneumonias, different things like that. So we'll do this. We come in, we tell our patients, we want to see you do about 10 breaths in this. Typically, what I always told my patients is 10 breaths an hour is typically what the order is, but I would go in and be like, hey, you know what? Why don't you just do 2 or 3 breaths every commercial break? That way you're not having to do it all in one sitting. You're not going to get lightheaded. You're not going to get tired from it. It's a commercial break. And then watch some TV, and then you're going to get all your breaths in. More than enough.
Is this something for tuba players, euphonium players to use if they're desiring to have more breath support?
I think that it could definitely help with more breath support. It can at least make you more conscientious. Like you guys have talked about how when you take your breath in, like how important it is to make sure that you said, was it circular or?
Yeah, it needs to be like around.
Yep. So this can help you with that, not doing that quick gaspy sort of breath, which watching you guys play, I would have thought that you would have seen more of that and even hear that that gasp sort of sound, but you guys were able to get your breaths in without doing that.
That's something we actively work on, I think.
That felt really great to breathe through that too, also, I'll say.
Do you want to give it
Brass players have been known. Brass players advocate for incentive spirometers. My teacher did, and there was a different type where it's a cylinder and a ping pong ball.
Yep.
And I think not only is it just the respiratory therapy action, but also the fact that you're visually seeing feedback on your airflow and air volume is really critical to see. Like that disc that goes up, is that showing the right flow? Airflow?
Yep. So if you want to take a look at it, just so you can see. So if we're down here, we know that we're not getting a big enough breath. Right. We're doing it too slow. So it's got to hover and it needs to be in your smiley face.
Gotcha.
If you get too high, it's saying you're doing it too fast, so you need to slow down. So it's just a visual in front of you telling you where it's at.
So it's encouraging a slow, steady breath.
And Nick, you have another device.
I do have another device. Now this one may not work in what you would think would be the typical sense, but this is a device. It's an aerobica is what we call it at the hospital, or an OPEP device, which stands for oscillating positive expiratory pressure. So what it does is this is one that you do that big deep breath in and then you blow out against it. And this has a valve inside it that kind of shudders a little bit, and it causes some back pressure within your airway. Now, this can help in the sense that by causing that shudder, it can help open some alveoli. It can also, in a roundabout, well, its intended purpose is to clear mucus. So it's a mucus clearance device. But this could be another tool that you could potentially be using as well.
Is it okay for someone to try it? Or
Yep.
Brad, you're the athlete.
So how do I do this?
So just take a breath in,
Yep.
and then you're going to blow out against it.
Sounds good. It's very interesting.
What did you feel?
Yeah, I could feel that feedback, and after a while, I tried to push a little harder to see how it would respond, and yeah.
And there's a thing on this as well. So on the back, we can make it harder or easier to blow against.
Yeah, okay.
So that was the easiest.
Yep.
Now this would be the hardest to blow against.
Okay, yeah.
You can do it.
Yeah.
So you could feel little
that.
pulses of air going.
Yep. So I could feel that difference. That's very cool.
Yep. So it's a way to it also, because it's a mucus clearance device, it vibrates your lungs internally as opposed to doing it externally. And so it's one of the best ways, in my opinion, to actually clear secretions.
So there's something in medicine we talk about pursed lip breathing and positive end expiratory pressure and sleep apnea devices that blow up your lungs that might expand your alveoli. Jeff or Nick, you want to discuss? I mean, is that very similar technique, except it's pulsatile? Is the pursed lip breathing try to open up your lungs?
So this has it is a PEP device, so it does have some expiratory pressure.
What does PEP stand for?
PEP stands for positive expiratory pressure. And then there's another term that we utilize in my field. It's called PEEP, which is positive end expiratory pressure, which is the pressure remaining in your lungs at the end of exhalation. So if you use a CPAP device, that's giving you continuous PEEP.
For sleep apnea.
For sleep apnea, continuous positive airway pressure. Now this, when it has that shudder, it stops and it's allowing you to, causing a sudden burst of intrinsic PEEP at that point. So this kind of has a similar process through that. If Jeff has anything to.
This is an area here where you said that when we look at the literature, there's a lot of opportunity for studying these kind of things, and to listen to you guys say, wow, that seems like it might be really helpful, makes me want to think that there's opportunity there to do more study of that, because to date they're really, these things haven't been particularly rigorously looked at.
So maybe to transition from the aerodynamics and the pressures to contagion. I understand that in band you often are told by your instructor to switch instruments with your fellow bandmates. Is that something that you experienced?
Yeah, it's happened, and I feel like high school and middle school bands is where it happens most. And once you get to that collegiate level, they're like, don't do that. That's not good for you.
And what kind of precautions did they take to prevent spreading the flu or cold from one student to the other?
Just like an antibacterial spray that you put onto the mouthpiece, and it's kind of got a minty little taste that you can taste, yeah. And
typically they would just spray like right here in the mouthpiece, but nothing else like through the horn. We do try and clean our horns out once a year-ish, just to get all the gunk. You might imagine if you ate lunch right before a rehearsal or something, some bits might end up in here, but we try and not do that as much as possible, and clean our horns out and give them a little bath.
Well, there was a story of a very lethal instrument. This man was playing it in England and was not very healthy, and he moved to Australia and he got very healthy. Then he came back to England and played his instrument and died. This is an article that was published. He didn't take his instrument with him to Australia. Can you have an idea what instrument it was? It was a bagpipe. So his autopsy showed that his lungs had the same fungus that the bagpipe had.
Sure.
Oh, wow.
And so there are situations where instruments can be dangerous. And I know that, Jeff, you had talked about hypersensitive pneumonitis from playing instruments. Now, is that infectious, or is that some other type of problem?
Well,
what is pneumonitis?
So pneumonitis is just inflammation, and pneumo is the lung, right? So it's inflammation of the lung. And when you look at what people have cultured out of your guys' instruments, it's pretty awesome. Bacteria, fungus, a form of mycobacteria that's related to TB but not infectious, so we call it atypical mycobacterium, have all been cultured out of these instruments pretty regularly if you look for it. I think fortunately it usually doesn't cause, clinically important lung disease, but there's case reports like Harry was talking about that you can find in wind instrument players, and that the whole gamut, of trombone and saxophone and tuba and everything. So you can get an infection in the lung. Hypersensitivity pneumonitis is where your lung reacts to antigens that are attached to the bacteria or whatever the infection is that then cause inflammation of the lung. And the treatment for that is really avoidance, more than antibacterial or antifungal treatment. Pretty uncommon, but when you start looking, you can find case reports of these in the literature. So I have no idea medically how to recommend how often you should clean your instrument. Not sharing instruments seems like a good idea. Yeah, and probably, more than once a year would not be a bad thing, but it's a pretty uncommon problem.
And John, you mentioned the good news is that these instruments are pretty much, you're blowing into them, you're not breathing out through them.
Yes, hopefully. I mean, not only is there it would be a bad idea to inhale through your instrument because of the environment, as you mentioned, but also any obstruction in your inhalation slows you down as a tuba or euphonium player and might limit the amount of breath you can get in a nanosecond, which is what we need to do. So I definitely discourage students from breathing through their instruments. Sometimes they do it accidentally, sometimes they do it partially, but we should be breathing around our mouthpieces.
Can you take your mouthpiece off and demonstrate how, with a focus on the breathing, just holding your mouthpiece up to your...
Yeah, it might be easier to see. So what I'll do is I'm going to simulate playing a long note and taking a quick breath and getting back to the long note. So it has to be really quick and through the sides. And I try not to inhale through the horn.
Great. And Matthew, you demonstrated earlier something, I think, did you call it a spit valve?
Yes.
There's a better name for it.
The technical proper term is a condensation release valve. I think spit valve is just the common nomenclature, but I had a professor get after me for that once, but he was kind of an old school professor.
Condensation release valve.
Yes. So yeah, when we play brass instruments, obviously there's spit, moisture coming out of our mouths. So there's a few. So there's one here, and each instrument model would be different. So I have one here, one down here, and then one in the back. And then sometimes spit gets in here, but the valve is so small that I just take it out, take the slide out. But it's pretty easy. You just open it up and just kind of blow a little air. So I don't have anything there, just a little bit there. So not too bad, but if you don't routinely take them out and empty out your spit while you play, it can kind of build up, and then you can hear it gargle like you're gargling water or something in your mouth.
So that sounds good. Well, this is an opportunity to have a free medical clinic advice if you have questions for Nick or Jeff about breathing or other thoughts.
Well, the unique thing to our situation is that we exhale relatively slowly and inhale extremely quickly. And we also have to do that without creating tension in our throats because that affects our tone. So I was wondering, and it usually helps us to stay relaxed. And one of the best tips that I ever got was to think of inhaling as like you're inflating, and as you're exhaling, you're deflating. The other thing that helps us is to not hold or suspend our breath, because that creates tension too. So I was wondering if you could give any advice on avoiding tension, trying to relax, and what would help with our completely different speeds of air input and output.
So your primary inspiratory muscle of breathing is your diaphragm. And so people talk about diaphragmatic breathing. So you're focusing on taking that breath in kind of at lower down in your chest. And you do have what we call accessory muscles of breathing that you use to breathe in, and those are kind of up in your upper chest and your neck. I would suspect that those might be the ones that you'd like to avoid activating, Nick. Would you think that'd be fair?
Yeah. Well, in the hospital setting, we kind of talk about when people are using accessory muscles up around their neck and their throat. We call it trach tugging, where there's that little pit right here. And when people are having a hard time getting breaths in, that sinks in. So a deep, deep divot happens there. It happens a lot with RSV, croup, stuff like that. So that's a sign that we look for that helps us know kind of respiratory-wise what's going on with our patient. As you're kind of alluding to, for trying to relax, I've seen that it's those quick, trying to get that breath in where you see more of that tracheal tugging per se. So trying to be more, I guess, conscious of that.
That's really helpful because that's something I can see in my students, and it's something we can probably all control. Take a really quick inhale without doing that pull. That's great advice. Thank you.
I ran the voice clinic for about 30 years at the University of Iowa, and one of the more common problems we saw was muscle tension dysphonia. And our speech pathologists work on breath support very much with this group of patients. And the problem that you have to address is using a little more energy down here, but not transferring it to tension up here. It sounds like that's very similar to what you're describing. So you have to relax here as you're increasing expansion and muscle activity down here. And there's some real training and some tools that they use that sounds like there could be some crossover for your musical instruments for their voice production that they're having.
Yeah,
So I do some distance running just for fun, because who doesn't want to do that when they're 40? And one of the things I trained with someone who he helped me out a lot, and he talks about belly breathing, and it works really well with running, where as Jeff was saying, it's getting your diaphragm involved, using your diaphragm because that's the best muscle for it, and not trying to focus, like not using your accessories. You're using your belly for all of it. It allows you to get your bigger, deeper breaths.
Great. Well, this has been terrific. Additional detail regarding this and other episodes of Music and Medicine on Mondays can be accessed by searching the internet for Music and Medicine on Mondays at Iowa, or looking at our website or the QR code displayed.